Okay. Wait me a moment. I need to set the auto get in. Wait. Okay. So let them can in by themselves. Okay. Yeah. Now. Okay. Good. Good evening, everyone. Hope you can hear me clearly. I'm Susanna. So tonight we have a good topic about our thyroid system. So tonight we will have me and Angelina to help assist me to present for all of you, and let us learn about our thyroid system. How does the thyroid manage your metabolism?
Nestled in the tissues of your neck is a small, unassuming organ that wields enormous power over your body. It's called the thyroid. Like the operations manager in a company, its role is to make sure that the cells in your body are working properly. It does that by using hormones to deliver messages to every single one of them. This high-ranking organ is made up of lobules that each contain smaller cells called follicles, which store the hormones the thyroid sends out into your blood. Two of the most important hormones it produces are thyroxine and triiodothyronine, or T3 and T4. As messengers, the hormone's job is to instruct every cell in the body when to consume oxygen and nutrients. That maintains the body's metabolism, the series of reactions our cells perform to provide us with energy. This hormonal notification from the thyroid gets the heart pumping more efficiently and makes our cells break down nutrients faster. When you need more energy, the thyroid helps by sending out hormones to increase metabolism. Ultimately, the thyroid allows our cells to use energy, grow, and reproduce. The thyroid is controlled by the pituitary gland, a hormonal gland deep in the brain that oversees the thyroid's tasks, making sure it knows when to send out its messengers. The pituitary's role is to sense if hormone levels in the blood are too low or too high, in which case it sends out instructions in the form of the thyroid-stimulating hormone. Even in this tightly controlled system, however, management sometimes slips up. Certain diseases, growths in the thyroid, or chemical imbalances in the body can confuse the organ and make it deaf to the pituitary's guiding commands. The first problem this causes is hyperthyroidism, which happens when the organ sends out too many hormones. That means the cells are overloaded with instructions to consume nutrients and oxygen. They become overactive as a result, meaning a person with hyperthyroidism experiences a higher metabolism, signaled by a faster heartbeat, constant hunger, and rapid weight loss. They also feel hot, sweaty, anxious, and find it difficult to sleep. The opposite problem is hypothyroidism, which happens when the thyroid sends out too few hormones, meaning the body's cells don't have as many messengers to guide them. In response, cells grow listless and metabolism slows. People with hypothyroidism see symptoms in weight gain, sluggishness, sensitivity to cold, swollen joints, and feeling low. Luckily, there are medical treatments that can help trigger the thyroid's activities again and bring the body back to a steady metabolic rate. For such a little organ, the thyroid wields an awful lot of power. But a healthy thyroid manages our cells so effectively that it can keep us running smoothly without us even noticing it's there.
So let me introduce Angelina to help us to present the thyroid system tonight. Thank you, Angelina.
Hi, everyone. So just helping Susanna out with her presentation. Okay, what is the thyroid? The thyroid is a very important endocrine gland in vertebrates. In mammals, it is located below the thyroid cartilage in the neck on either side of the trachea. You could see that in the photo on the side. The thyroid controls the rate at which energy is used. It makes protein and regulates the sensitivity of other body systems to other hormones. It affects intelligence, growth and development in children, and metabolism in adults. The thyroid regulates these responses by making thyroid hormones. The two main ones are the triiodothyronine, or T3, and the tetraiodothyronine, which is called T4. So T3 and T4 are synthesized from iodine and tyrosine. The thyroid also produces calcitonin, which regulates the balance of calcium in the body. So this one is actually showing what a healthy thyroid looks like and what other thyroids that are diseased look like. So let's look at the first one. The first one is a healthy thyroid, and then the rest actually shows the various thyroid gland diseases. There's the goiter, which is an irregular growth of thyroid. The next one, the third one up the top, is the thyroid with a nodule. It is a benign lump. And then the next one, the last one up the top, is a photo of one with thyroiditis, which is an inflammation of the thyroid. And on the second row below, the first one shows a multinodular goiter, which is also a thyroid disease. The next one is a thyroid with Hashimoto's disease, or something called hypothyroidism. The next one is a photo of a thyroid with something called Graves' disease, which is an overproducing thyroid. It overproduces hormones, or it's called hyperthyroidism. And then the last one with the black blob there is a picture of a thyroid with a cancer. So a cancerous thyroid cancer. Thyroid diseases can generally be divided into 5 types. Each has its symptoms, and it is possible for a person to have more than one of these conditions at the same time. The first one is hypothyroidism. This is caused by insufficient free thyroid hormone in the body. It was mentioned in the video earlier. The next one is hyperthyroidism, which is caused by too much free thyroid hormone in the body. So hypo is insufficient, hyperthyroidism is too much. Structural abnormalities, mostly like a goiter, which is an enlargement of the thyroid gland, is also a disease. We've seen that. The next one is a neoplasm, which may be benign or a malignant or cancerous thyroid. Abnormal thyroid function. An abnormal thyroid might not have any clinical symptoms. And the thyroid disease can occur in people of any gender or age, but women are much more likely to be affected than men. So how thyroxine works and how does hypothyroidism occur? Hypothyroidism is an endocrine disease. It's the opposite of hyperthyroidism, but both belong to the abnormality of a thyroid function. Hypothyroidism means that the thyroid gland cannot produce enough thyroxine for the body to use, which may lead to obesity, fatigue, and even depression. Hypothyroidism in women is 2 to 8 times than that of men. Especially middle-aged and elderly women should pay more attention. The impact of female emotional problems is a significant factor in hypothyroidism. The symptoms of many people with hypothyroidism are mild and inconspicuous, and thus are easily overlooked and not treated early. Hypothyroidism is not necessarily a problem with the thyroid itself. Sometimes it may be a problem with the brain that affects the secretion of the thyroid. Now let's look at hyperthyroidism. Hyperthyroidism is caused by it causes the metabolism to speed up, and it causes systemic discomfort. The symptoms are weight loss, because there is rapid weight loss due to increased metabolism. Another symptom is rapid heartbeat and atrial fibrillation because the metabolism is too fast and the human body cannot handle it. It may cause arrhythmia, and in addition to causing a burden over time, it will also worsen the body's blood circulation and even appear with edema or heart failure. It could even cause edema or heart failure. Another symptom is an increased appetite. In order to maintain the energy needed by the body will try to make up for the energy that is metabolized too quickly. So you feel hungry a lot of the time. And one other symptom is bulging eyes. This is a classic symptom of a thyroid disease, but it does not apply to everyone. It is more common in patients with Graves' disease. So if you have this symptom, you should quit smoking and also get your thyroid checked. So what are the 7 foods that can help prevent hyperthyroidism? So we've got leafy greens. Leafy greens such as spinach are an important source of calcium. Number 2, fish. Fish is rich in omega-3 fatty acids. Fatty fish like salmon are an important source of vitamin D, which helps improve your body's calcium absorption. Number 3, fermented foods. These are foods such as kimchi, kombucha, kefir, and sauerkraut. They all contain probiotics. Number 4, lean meats and liver. These iron-rich foods help increase your iron levels. Number 5, fresh fruit like apples, avocado, and berries are good options for those with hyperthyroidism. Number 6, olive oil. Olive oil can reduce inflammation in the body and can improve thyroid function. And number 7, Brazil nuts. Selenium has been shown to have possible benefit in autoimmune thyroid diseases like Graves' and disease, for which Brazil nuts has got plenty of. What are the 4 foods to avoid to prevent hyperthyroidism, or if you've got hyperthyroidism? Number 1, seafood. Although iodine supplements and consumption may be beneficial to people with hypothyroidism, a low iodine diet is actually recommended for hyperthyroidism because too much iodine can worsen hyperthyroidism. Another food to avoid would be cruciferous vegetables. Goitrogens, which are substances found in cruciferous vegetables, legumes, and some root vegetables, are thyroid hormone disruptors. So cruciferous vegetables are broccoli, Brussels sprouts, cauliflower, red cabbage, those sorts of things. Another food to avoid would be gluten. There is some evidence that gluten can cause inflammation. So try to have a gluten-free diet. And number 4 is coffee. We need to avoid coffee if you've got hyperthyroidism, because caffeine should be avoided as well because it is a stimulant and can worsen fast heart rate and cause heart palpitations. Now we go to goiter, causes of goiter. Have a look at the photo. A person with goiter has got a bit of an enlarged neck. So iodine deficiency is essential for the production of thyroid hormones. If a person doesn't get enough dietary iodine, hormone production drops and the pituitary gland signals the thyroid to make more. This increased signal results in thyroid growth. Another cause of goiter is inflammation. Thyroiditis is inflammation of the thyroid caused by an autoimmune disorder, bacterial or viral infection, or medication. Pregnancy could cause goiter, a hormone produced during pregnancy, which is called human chorionic gonadotropin, or for short, it's called HCG, may cause the thyroid gland to be overactive and enlarge slightly. Graves' disease, when the immune system produces a protein that mimics TSH. This rogue protein prompts the thyroid to produce or to overproduce hormones and thyroid growth. Hashimoto's disease is an autoimmune disorder, an illness caused by an immune system attacking healthy tissues which don't produce enough hormones. And that's also called hypothyroidism. That could be a cause of goiter. Thyroid nodules could also cause goiter. Thyroid nodules are the irregular growth of thyroid cells that form a lump. The cause of nodules is not clear, but there may be multiple factors like genetics, diet, lifestyle, and environment. And another cause could be thyroid cancer, which is less common than any other cancers and generally treatable. About 5% of people with thyroid nodules are found to have cancer. Another thyroid disease is neoplasm. Thyroid neoplasm might be classified as benign or malignant. Benign neoplasms are thyroid adenoma is a benign neoplasm of the thyroid. Thyroid nodules are very common, and around 80% of adults will have at least one by the time they reach 70 years of age. So approximately 90 to 95% of all nodules are found to be benign. Then there is what we call malignant neoplasms. An example, papillary thyroid cancer. This one, it is found in up to 80% of all thyroid cancer cases. It tends to grow slowly, but often spreads to the lymph nodes in your neck. Even so, you have a good chance for a full recovery from papillary thyroid cancer. The other malignant neoplasm is called follicular thyroid cancer. This makes up between 10% and 15% of all thyroid cancers. It can spread into your lymph nodes and is also more likely to spread into your blood vessels. And the third one is medullary cancer, which is found in about 4% of all thyroid cancer cases. It's more likely to be found at an early stage because it produces a hormone called calcitonin, which doctors keep an eye out for in blood test results. And the last one is the anaplastic thyroid cancer. And it can be the most severe type of cancer of the thyroid because it's aggressive in spreading to other parts of the body. It's rare and it's the hardest to treat, though. The other one is abnormal thyroid function, another type of thyroid disease. So, what is an abnormal thyroid function? Thyroid dysfunction refers to the concentration of thyroid hormones in the blood above or below the normal range. And the patient may have a goiter, commonly known as a big neck. And in patients with goiter, the thyroid function can be high, normal, or low. In other words, whether the thyroid gland is enlarged or not, and whether the thyroid function is abnormal are two different things. So, what causes abnormal thyroid function? The cause of hyperfunction is mostly an autoimmune disease, also known as Graves' disease. Patients often have a family history, maybe accompanied by protruding eyes or skin lesions, especially on the front of the lower legs. Other more common causes are multinodular goiter. Common causes of hypofunction are chronic thyroiditis, also known as Hashimoto's thyroiditis, or post-thyroid surgery, radioactive iodine therapy, and pituitary disease. So, what are the symptoms of abnormal thyroid function? If the function is too high, symptoms such as heat intolerance, easy sweating, heart palpitations, tremors, anxiety, poor sleep, and weight loss will occur. People who are easily stressed due to high mental stress will also have similar symptoms. Sometimes it is difficult to distinguish, but a blood test can completely confirm the diagnosis. So there are the symptoms: sweating, enlarged thyroid, rapid heartbeat, nervousness, heart intolerance, irritability, tremor of fingers, difficulty sleeping, warm, moist palms, scant menstrual period, infertility, muscle weakness, weight loss, frequent bowel movements, soft nails. Any one of these can actually indicate an abnormal thyroid function. So keep an eye on them. So how do we prevent thyroid disease? Remember 3 essentials and 4 minors. So what are the 3 essentials? Number 1, your thyroid needs iodine to work properly and produce enough thyroid hormone for your body's needs. If you don't get enough iodine, and you run the risk of hypothyroidism or a goiter. The second of the 3 essentials, you need to eat more nutritious foods such as fresh vegetables and get enough protein, calcium, and potassium containing fruits. And number 3, we need to do regular checkups. Over 30 years old is recommended to have a checkup every year. So they're the 3 essentials to prevent thyroid disease. So what are the 4 minors for preventing thyroid disease? Number 1, we need to avoid processed food. A lot of chemicals can alter the thyroid hormone production. One needs to avoid any kind of processed food. They are on the edge of the thyroid disorder. Number 2, avoid soy. We need to limit the soy intake, as soy alters the hormone production. Number 3, we need to stop smoking. The toxins released during smoking can make the thyroid gland oversensitive, which can lead to thyroid disorders. And number 4, we need to reduce stress. Stress is one of the major contributors in many health disorders, including thyroid disease. Vitamin D. Vitamin D has a very important role. Vitamin D is a trace vitamin found in certain foods, including the fats of herring, mackerel, sardines, and tuna. It is sometimes added to dairy products, juices, and cereals to make it easier to get it. Among them, such products are called vitamin D fortified products. However, the vast majority of vitamin D is obtained by exposure to sunlight, accounting for about 80% to 90% of the body's needs. Vitamin D can also be synthesized experimentally. Vitamin D can be used to treat and prevent hyperparathyroidism. Since vitamin D is involved in maintaining the constant of certain materials, such as phosphorus and calcium, when phosphorus levels are low, such as hypoparathyroidism and pseudo-hypoparathyroidism, we use vitamin D.
So thank you so much for Angelina, clear presentation. Thank you so much for your time too.
You're welcome.
So let me introduce about the lightweight product, which product can help our thyroid function. So lightweight product actually is using the photobiomodulation, and this is using our own body temperature and the OR to activate the patch, and then it can reflect our infrared light back to our tissue in order to achieve our self-healing effect. So this patch is actually just put in our acupuncture points and let our body energy flow to stimulate our own body cell in order to achieve specific benefits. So, and it's very easy to using this patch, and then it just put in on the skin. Actually, we have a lot of acupuncture point in our body. So the infrared light from our human body is reflect back to our tissue, and then it increase our cell growth and activity, and especially can transmit the information. Each patch have their own frequency, and which is have for the specific benefits. So which patch can help the file? So I have some recommendation for all the people, and if they have a viral issue. So first of all, our file is just in our both sides of the net. Okay, so we can use this patches way. So we found our location REN 23. So we can using the ion or put it in the ST9 in the both sides here. And the other one we put SP6. So ion patches can reduce our inflammation, and the SP6 competes can control our appetite and also can balance our hormone. So this is the location we put ion and SP6. Okay, so another one is the X39, because X39 can activate our stem cell. When our stem cell can activate more, so it can go to our body to find out our problem and healing it. So we put X39 in our back net or under our belly button. Both location is okay. So this is another patching way. We can find our bottom of our net. It's called T2 acupuncture point, and we put X39 in here, in this location. Then in the both side, we put energy enhancer of our neck. And remember, white hand side, when we're using the energy enhancer, white color put in our white hand side, and the tan color put in left hand side. It's just like a positive and negative, and then it will bring our blood circulation on this area. So we put a pair of energy enhancer in ST9, this location for our file location. And one more is to put the glutathione. Glutathione actually for the detoxing, and also for the detoxification, and also can reduce the bacteria. So we put in our fold in this location. So this also can help our bile system. And here another patching way, we put a carnosine. Carnosine is one of the product which can helping us for our metabolism, and also it can help for the whole body health issue. So, and also can regenerate our tissue. So it can put in the CV22, and our X39 put on GV14, so our back net. And here we also put in energy enhancer. Energy enhancer we can put a little bit lower on the ST10, also in both sides of the net, both net, right and left, but we put a little bit lower on ST10. So benefit of the X39 is can activate and strengthen our stem cell to make them healthier and more vibrant, and you will be able to regenerate the body and have a better sleep quality. And it also can boost our immune system, relieve mild pain, and improve cognitive function. So it also can improve skin texture, reduce our fine line and wrinkle, and enhance the natural healing of wounds. So for the X49, the main benefits to improve our strength and physical performance. Also, it can help for the cardiovascular health, cognitive function, and the muscle recovery. So, and also can combine with a health diet and exercise program for fat loss and the bone health. It's also help for grow the hair. So for X39 and X49, we will recommend X39 stick on the back of our neck and X49 stick below our belly button. And actually both X39 and X49 can be put any location in your body. So because the stem cell actually is a very smart, they can go to some location it need to repair. So where you put, actually it still can function. But the recommendation is because our back neck and under the belly button is a joint, just like a junction of our whole body acupuncture point. So we will recommend put these two locations for the most people get the best effect, okay? So SP6 Complete, this is a good product for the vital function because it can restore the circular physiologic and also can control appetites and balance our hormones. And also it can send enough sugar message to control our craving. So and then it can help to burn more fats. So it's also an anti-aging product. And ion patches, actually fire will occur because of some of the inflammation in our body and also emotion issues, especially for the woman. Why we have a more percentage than men to get the fire problem because of for the stress and the emotion. And ion patches actually can restore our stress in the body, and also it can help to promote a relaxation. Some people, they can't sleep good. Maybe this using the silent night also cannot fall in sleep because of they are very stressed and the brain non-stop thinking. So on this situation for the insomnia, we will recommend using ion patches. So because ion patches can also reduce the inflammation in the body. And also if you have fever or if you get some like some pain because of the inflammation, using ion patches also very work and very effective. You will see the result. And ion also an anti-aging product. Glutathione is one of the master of antioxidant because it have a 300% increase just in 24 hours. This is a lot of statistic and experiment reports showing that using lightweight glutathione patches, just one patches, will increase over 300%. So the glutathione level, when our body glutathione level increase, it can support our immune system. Also can help us to promote the detoxification and also can eliminate heavy metal from our body and improve our skin sensitivities and spot and wrinkle. Actually, this is also a natural whitening. And the carnosine actually is increased stamina by up to 125% and improve our whole body strength and the flexibility of our muscle. And also can improve our overall health and improve the bioelectrical and also of the irregular heart rate. It also can improve our digestive problem. So a lot of people start some body problem start from the digestive issue. So you can just simply apply the carnosine patches outside your digestive location and drink with some water. So you will see the results just in 1 week. You will find that it can improve a lot. And also it can improve the degeneration of the original tissue. So it's also an antioxidant product. An energy enhancer able to increase our energy level and endurance, and also support a physical fitness routine, can promote blood circulation and burn our fat. And somehow some people, they will feel some pain in their body. Actually, energy enhancer also can help because it brings up the blood circulation. When your blood circulation is more smooth and the energy flow in the body more smooth, so your pain will gone. So energy enhancer also can apply when you get some body pain. So lightweight actually is no need for the injection and no need take any medicine. It is out of the medical, is another alternative for you to choose. And this is activate our own cell healing ability of our body cell with the wavelength, frequency, and no drugs, no chemicals, and no stimulant at all. And the benefit is no effect at all. So it's a natural, safe, reliable, effective, and also it's easy to use and economic. So the lightweight product also we can design for different health benefits and issues. So and all clinical verified effects to protect by more than 130 patents. So now we have the promotion patch for the X49 and X39, a bundle set. The promotion up to end of July. So we take the chance to buy the bundle set in a cheaper price. If you buy separately, distributor price for each is $99.95 and the retail price is $149.95. So we will recommend all our friends and relatives to join as a distributor in order to get the more cheaper. And if you buy in a set bundle, now it's just $169.95. And and the other patches now we are selling in retail price $79.95 and distributor price is $69.95. If you buy 2 more patches, you will get $5 cheaper in distributor price. If you buy 3 as one, you will get $10 cheaper at each one. So you can select in the package so to order from our website. So lightweight product is helping us for living long, live healthier, and live younger. I hope this information can help you and let you understand more about the lightweight patches. So is there any question for our today information? Is it clear? So I see we have some Australia fan, Malaysia fan, and Singapore fan here. Okay, anyone have any question? So you can open your mic. So very clear, right? So because I'm now making it more short and hope that is more detailed and simple. And then I have Angelina to help to present in very, very good English. I hope all of you can understand more. So for the file, actually, I also have some friends. They are suffering for file and they using around 6 months. Later on, I can ask them to share but they are speaking in Cantonese. It's hard to ask them to share. But I can share one of the case. Before the doctor asked her need to do the operation. About 8 months ago, and when I know her, she already arranged the appointment on last year's October. October. And I know her. I know her on the same month, October. I just asked her, can you try to extend maybe with later to do the operation and try 2 months using lightweight product, and in order to let's see her file is any improve. And then she said that yes, because she actually very hesitate to do the operation. She's so scary because she's afraid after that have a scar in here, and most of them they have a scar very long in here. She feel very ugly on the beauty side. She's thinking on the beauty side. But on that time I'm just asking her, so if you can try to extend the operation 2 months or 3 months after, so let's see your situation. And then she tried to using the lightweight product with the glutathione SP6 and also X39 on that time, mainly this free product. And after that, she told me that because she's very thick here on that time, but she's very thin, but her neck is so thick. I will show you the picture later on. I will ask her consent to send out. So, and after that, she using around 2 months. So after she go back to check before the operation, the doctor did show her that the data, she's decaying. So it's meaning that the file system is a more function, and then it did improve a lot. So that's why she make her own decision to no more do the operation and just keep use the lightweight product. Of course, she has take some supplements to support, but up to now she's controlling well, and then she's not going to do the operation anymore. So this is one of the good testimonial for all of you. If you have some friend they with the thyroid problem, so let's try to improve their daily diet. So eat the right food. So that's why today I go to share a lot of food in different situation, what they can eat, what they can't eat. Some people they are eating wrong. That's why they accumulate too many iron on the body. So that's why today, especially in different situations, you have to avoid eat some food, and you have to eat more. What kind of food you have to eat more in order to improve your situation. So that's why I hope our information today can help you and the people surrounding you if they have a viral situation. And now for the X49, it did also help a lot for our cardiovasculation and also for the blood circulation. For the muscle part, if our body more strong, actually it can also reduce our sickness and disease, right? So hopefully this information can help you more, and I will try to find someone to share their testimonial next week. Okay, so any more question? Any more question?
Suzanne, I actually have a friend
Yeah.
in the US.
Yes,
She
okay.
had thyroid cancer,
Okay.
and she had an operation. But the operation, there were mistakes in the operation such that she lost her voice. They cut some cords, something on her vocal cord accidentally, and then the nerves as well got damaged quite badly. And so she's had the operation for more than a year now, so she still hasn't got her voice back. And the pain in the neck, and I could see it, the cut here is all black, and it's ugly
Yeah.
thing. I got her to try X39 and the YH, but she only tried it for a month or so and didn't want to continue. And she said it doesn't get rid of the pain. It's so painful, she said. And even today I was talking to her, she said she's in pain. So what should I do for her? Should I
Uh, I,
just,
I think you have to try to help her to improve the pain first. When the pain gone, she will have a more confidence. So you can try to use the Eon and Ice Way. And the
Ian and
time,
Ice?
actually, recently I have one case. She is not a viral case, but she is a cancer case. She's have a 26 years ago the cancer, but three time again. So that's why she have a lot of chemos and a lot of the operation of her. She's suffering a lot, and one of her years just totally gone because of the got the operation by some mistake. So that's why she's lost the her function on 1 year. And after she using 6 months, she's very clear to mention to me, after 6 months of using X39, so her ears function coming back. She can now hear some sound because before he totally cannot hear on 1 year. But now he can hear some sound is much more clear now. And also he keep using the Canosen. Canosen is one of the good for the help us for our degeneration cell to become regenerate. So, but it's stronger the stimulant for 125%. That's why in step by step, you cannot immersion or expect it happen just in a month. Cannot, but step by step you will see the improvement. And also this patient actually she got a lot of bit the blood from the nose after using the X49 and the Canosen, especially these two products. Because the X49 just 2 months, around 2 months in Hong Kong, she tried to use this 2 months, and she found that a lot of the blood come out from the nose. On a day, she got around 50 ml, 50 ml, but coming and continue 20 minutes. But on that time, after coming out, she saw inside have a lot of tissue, just like jelly, just like a jelly come out. And then after this, she feel so like smooth already, so she can breathe deeply and not stuck anymore in
No
here.
more blockage.
No more blockage in here. She said that sometimes blockage is very headache, and now it's better after using Canosen and X49. And now she got some digestive issue. She cannot eat too much because she will go to the toilet for just like that, the diarrhea, or for she can't eat too much, and she will go to the toilet very frequently. And I just tell her it may be have some healing crisis on that healing the processing, but she trusts the product. She said at least she found one thing is she can hear some voice now. So for that years, it's 20 years totally cannot hear. After the first time, the chemo and after the cancer treatment, she cannot hear, lost all the sound on 1 year, and now it's coming back. That's why she's so happy on it. And she just tell me that after I teach her to put the Canosen on here, and then she's feeling the digestive issue is have some strong healing crisis, but after 1 week later, she feel good. But we have to ask them to overcome the healing crisis. So for your friend, maybe you first settle the pain. When the pain settle, they will feel more confident to continue use the patches. So using the Eon, using the ice way to help for the pain gone on this part.
Okay. Yep, I'll do that.
And is it her color turn back color?
The wound, the operation wound, it's black.
Yeah, some cell there.
Black and purple. Yeah.
That's why some cell dead, and then some dead cell cannot remove from the body, and it just stay in the skin. So that's why the skin texture and the color is very yeah. This is another issue. So try to ask her to try to fix the pain first, and later on then glutathione and help her step by step and aloe vera actually is really good for the skin.
Yeah.
I have a very dry, now Australia is very dry, right?
Yes.
very dry. My skin, my leg actually found that a lot of just like a snack.
Mhm.
When the nighttime is so dry, and then what I do, I just put the aloe vera in my body now, not just the face, I in my body, and then
Oh, wow.
yeah, I put just one day, and the other day I not see the snack skin.
Mhm.
And then I
Okay.
just apply every night because the aloe vera actually the night cream is very longer one, and I just found it's cheap because it's just 149.95, right, from Hong Kong to order, and but we need to deliver it to Australia for the extra cost of
Yeah. Yeah.
delivery charge. But actually it's good, but because it's quite good, so you can ask her, is she in US, she can order the
Yes, she
aloe
is. Yeah.
vera, she can use the aloe vera, the cream to just put in the neck.
Oh, uh-uh.
Mm.
Okay.
And one of our professional in Hong Kong, she's doing the cosmetic and the beauty business, and she teach us to put the aloe vera, the night cream, need very thick, not too thin. She said that like a mask, to thick, very thin, and the next day morning just wash by water. Don't do other thing. Don't wash by cleanser. You just wash and then put the day cream. She said that you will see the difference. And after I applied that, I feel my skin more water.
Yeah, you got good
You
skin.
see, my skin look better now. Yeah,
Mhm.
after I follow her way, like a mask, very thick one.
Ah, how many pumps? How many?
Four. I put 4 times. I put four
Oh,
times, five
okay.
times. And then, but she said that I put 10 times. She said that I put 10 times.
Oh.
I think it's just like a mask.
Wow. Okay, I'll do that.
And then
Yeah, 'cause
remember to put in the neck.
yeah,
Because
yeah.
if you just put on the face, not put it on the neck, then you will see a big difference.
Yes, yes. Yeah.
Yeah, okay. Hope this information can help all of you. So any more question, Tia, or any more question? So if no more question, we see you all next week. Thank you so much for attend our Zoom class every Monday. Thank you so much.
Thank you.
Thank you, Angelina.
Thank
Thank
you.
you. See
Bye.
you all. Thank you.